It's time now for a look at your health. Tonight we focus on men in your life and the new controversy surrounding prostate cancer screening. Joining me is Dr. Mitchel Goldman from UCSD to explain why the U.S. government says screenings actually do more harm than good. What's it do?
You know, the harm in doing screening is if you pick up early forms of prostate cancer, you have to do radiation therapy, surgical treatments, etc. But the problem is, since the PSA, the prostate screening antigen, has been involved in 20 years, we've seen a decrease in mortality from prostate cancer by 40%. So absolutely, getting your PSA test is going to save lives.
So you don't buy the government recommendation,
you know,
in other words?
I don't buy it. The urology societies don't buy it. And the reason is, if you get a PSA, it's going to basically save 1 in 1,000 men. So the government says, well, 1 in 1,000 men, that's not a lot. But let's go back to mammography. When the government just a few months ago said, you know, women don't have to get mammograms anymore because it only saves 1 in 1,000 lives, that didn't fly either. And so I think the government's trying to save money, but they've got it all wrong. It's like we should be saving lives.
I've once heard that if you live long enough, every guy will ultimately get prostate cancer.
Just about. You know, prostate cancer definitely increases in incidence as we get older. It's much more common after the age of 65. It's very, very rare after 40. Absolutely. If you and I live to 120, we're probably going to get prostate cancer.
Right.
But at this point, 1 in 6 American men will get prostate cancer versus 1 in 8 American women getting breast cancer.
Are there symptoms?
You know, there's really not that much for cancer. Now, as we get older, the prostate tends to enlarge, and so some guys, not us, might have increased urinary frequency. They have to get up in the middle of the night to go to the bathroom, and that's a sign that your prostate's getting large. If it's inflamed, which is getting large and inflamed, that can actually lead to cancer. So if guys are having problems urinating and increased urination at night, definitely that's the time to see your urologist or your general doctor. Get the prostate screening antigen, get the checkup, save your life.
How about prevention, other than having the test done, which you are a proponent of, diet?
You know, diet does have some role. If you eat a lot of red meat, high in fats, that has been associated to have a risk of cancer of the prostate. Smoking, maybe a risk, maybe not a risk. Exercise decrease. So all the things we talk about every week on the show, as long as you follow a healthy lifestyle, you're going to decrease your risk of prostate cancer.
Dr. Goldman, always good to see you. And it's some advice even though it's uncomfortable, guys, get the test done. Susan?
Absolutely.
Yes.